Today's guest is Mike Belkin. He is the owner of Men's Healthspan, which is a telemedicine clinic, and he focuses on health span, longevity, hormone optimization, metabolic optimization, and so he has a lot of good insights on overall lifestyle and how to just be hard to kill. The title for today is going to be Hard to Kill. And so we're going to talk about how to be resilient and how to overall just live your best life in Be Hard to Kill. So I'm here with Mike Belkin, and today we're going to talk about health span, longevity. The title of it is going to be Hard to Kill. And so I kind of wanted to jump into that. But first, can I just get you to introduce yourself, kind of what's your origin story, who are you, and what do you do?
Sure. Yeah, thanks for having me, Mason. Good to be here, man. Yeah, so I'm Mike Belkin. I'm a nurse practitioner, founder of Men's Healthspan, where we fix hormones and metabolic health. I'm located in Phoenix, Arizona, but do telemedicine. So I see patients in Arizona, Colorado, Florida, Washington, Montana. So it's all all telemedicine based stuff. No brick and mortar at the moment. I've been involved in healthcare in one way or another for I'm going to age myself, but it's about 30 years now. So first round of schooling included chiropractic school. So I went through chiropractic school. Loved all the science. Loved all the pathophys. Probably better pathophysiology than nursing school and NP school even. But at the end of the day, a little disillusioned by the kind of the sprinkle of voodoo that's in there. So long story short on that is I went to chiropractic school, did the education, never took the test, never actually practiced. Fast forward 10 years, I went back to nursing school, was an ER and ICU nurse for about 8 years. After that, went back to NP school and been an NP now for 9 years, about 9 years there. So a little gap in my resume there. So there was nothing too crazy there. I wasn't in prison or no witness protection or anything. I call that my California years. So there's some restaurants involved there, some business. I had a little stint where I did a health and fitness cartoon. So I wrote a comic strip called On Fit. So I did that for a couple of years. That kind of helped my health and fitness kind of background keep flowing there. And then
do you still do any of those? I think I saw one before, and I didn't know if
the ones you see are redone, kind of retooled. So I'll just get in there with Photoshop and change some of the wording on it to kind of update the modern theme. I haven't actually drawn in a pretty long time, so I'd be a little bit rusty. And it was pretty bad to begin with, the drawing. So I just kind of steal the old ones back and tune them up a little bit. But it's fun to do. It's fun to mess with.
That's stinking cool. I like that.
Yeah, it was fun. It was a fun thing.
Yeah, you're gonna have to post more of them to your socials so I can see them.
Yeah, I'll put some more up. I'll send you a link here too. Yeah, so the main thing is fixing hormones, fixing metabolic health, helping people age better, live better. The name of the company is Men's Healthspan, but I do see females. So I have a lot of women patients. I started off just seeing men, but then they have wives and girlfriends, and they want to feel good too. So you get their significant others feeling good, and they wanted some help too. It's hard to turn people away who want to give you business and want your help. So I end up with a lot of female patients too, and they're great. So it's nice to have the couples like that too.
Yeah, and it's really good because I didn't do females at first, and then sometimes I'd mismatch their libidos, or the women would be kind of jealous that these feeling much better.
Yeah.
And I was sending them away, but now we get to take them in, and it's so satisfying to see just both parties, flourish and do well.
Yeah, for sure. Yeah, they play off each other. Someone's feeling better. Someone's exercising more. Someone's eating better. And it's just, it fixes them up. It's great. Fun way to practice medicine.
The background, a lot of us that I talk with have some ER, ICU background. And it's funny how we all kind of fall into this health and wellness.
But I think there's something to it.
I think that is kind of how you've done the whole Be Hard to Kill. It's like you see the sickest of the sick with the ICU, the ER, you see all these that come in and you're just like, I just don't want that to be me.
Sure.
But what does the Be Hard to Kill mean to you?
Yeah, so exactly like you're saying too, you see folks come into the ER, into the ICU, and people who come in strong leave strong. Not always. I mean, bad things happen. You never know what you're going to get. Right? Be grateful for what you have. But in general, people who come in fit and healthy, they don't have prolonged hospital stays. They go directly home from the hospital. I had healthy people discharged directly home from the ICU instead of going to rehab all the time. Whereas if it was the opposite, they come in bad shape to begin with, prolonged hospital stay. Now they're in rehab. Bad things happen the longer you're in the hospital. You get some secondary infection. They end up being readmitted. So the idea is, if you come in strong, you have some resilience built up. You just have better outcomes when something does happen. There's going to be something's going to happen to you at some point. An illness, a surgery, a trauma, something's going to happen. So
Yeah, it's crazy. Just with hip fractures and you have to be bedridden for a little bit. Even if me, a pretty resilient younger guy, if I have to be stuck in bed for 4 weeks, it would be super detrimental overall.
sure.
Much less a frail, elderly, 80-year-old female kind of thing. And so,
Yeah, if you don't have that muscle
whatever.
to lose, you should, you're building some metabolic currency. You're building a bank account of muscle. You want to have it there for when you need it. It's nice to keep it and just keep building it, but it's you lay in a hospital bed for a week, maybe you lose 10 pounds, maybe you lose more than that even too. And the longer you're there, the harder it is to bounce back. So got to have it built
Yeah.
up.
In this kind of topic, we typically would throw around the word health span, longevity versus lifespan. But what does health span mean? It's in the name of your business. What does
Yeah.
that mean overall?
Yeah. So lifespan is the amount of time that you live. Health span is the amount of time that you're enjoying being alive. Right. So I mean, you just
Nice.
is enjoyable and functioning and happy days of your life. You're out doing the things you want to do. You're generally healthy. You don't have a lot of big setbacks. You're not spending the last 20 years of your life in a nursing home. You're out doing stuff. You don't want to be the guy who retires and now all the health stuff starts kicking in and it just worsens from there and you decline, and it's not a good way to go out. So stay as healthy and happy for as long as you can and enjoy those years, and that's what you call building health span.
And what do you think are the biggest drivers in developing, to get a good health span to enjoy those last years of your life? What do you think people need to be doing 10, 20, 30 years prior to those years?
Yeah. First, it's never too late to start, right? A lot of people think, well, I should have, you tell me I should have started this in my 30s and I'm 60. Oh, well, I just give up. There's good studies that show that people, well into their 70s, 80s, they get into a strength training program, they improve their health. Now they're not using a cane anymore. They're just, they're getting some improved function. So never too late. You start from where you are. But it's the big general things. You don't want to be overly fat. You want to make sure you have a decent amount of muscle mass. You can do your functions of daily living. You don't want to be letting your blood pressure run too high. You don't want your blood sugar to be running too high. I know some people don't like to talk about it, but you should keep an eye on your lipids too. You don't want those to get out of control. You're basically trying to avoid, what are the biggest things that are the most likely things to kill you, right? And let's try to mitigate those things as best as we can. So you stay metabolically healthy, you stay relatively lean, carry a fair amount of muscle mass, keep an eye on your metrics like your blood pressure and your blood work, and you're checking most of the boxes. You're doing better than most of the population, and you just keep pay attention and you can get it done.
What does metabolically healthy mean? Like, what are you looking at with somebody to determine if they need improvements in this area, and what do you do to improve that?
Sure, sure. So I mean, we're looking at some blood markers like hemoglobin A1C, right? So that's a measure of your blood sugar over time. We don't want that, you don't want that creeping up. We don't want that getting too high, approaching diabetes. Again, keeping body fat under control. Body fat is, adiposity is inflammatory. It's a word people like to throw around. And how do you reduce inflammation? There's a way to actually do it. Besides some pill or some fancy thing, get rid of some body fat. You're going to drop inflammation. That's going to help everything in your body. Right now, it's just healthier for your blood vessels. It's better for your blood pressure. All those things. Um, You don't want to let your blood pressure get out of control. People seem to not be too worried about letting it run a little bit high. Like, oh, my doctor told me it's not that bad. Over time, that's going to add up, though. Now you're beating up your kidneys a little bit. Again, back to blood sugar. You let your blood sugar run too high for too long, or you stay a little too, a little too fluffy, a little too overweight for too long. Now it's affecting your liver. You have some fatty liver, and this stuff adds up. You don't want to be the guy with one thing from all of these columns going on. Now you're pretty unhealthy, right? You end up being this kind of metabolic dumpster fire at a point. So you don't want to end up there.
Yeah, what do you think the first couple things are to start improving that to help prevent all those ailments?
So unfortunately, it's not a pill you can buy on Amazon. I know everyone wants to hear that. Let me write down the link here. You need to get up and move. You need to do some simple, consistent things and just do it. Keep doing it over time. You need to do some sort of resistance training to build some muscle. That doesn't mean you have to go to the gym. You could do modified push-ups and squats at home. That's fine if you don't love it. You do the minimum, but do something. Keep your cardiovascular fitness relatively good. You want to be you don't get winded doing normal activities or a light hike or that kind of thing. Keep an eye on your sleep. You don't want to be, people kind of seem to pride themselves on being the person who can get by with, 2 or 3 hours of sleep. Oh, that's cool. Do it once and, show off that you can do it. But doing that over time, it's just not good for you. It's going to catch up with you. People want to, they want to take fancy things for recovery. There's no fancier thing than sleep. You dial in your sleep, you can throw away your whole cupboard of supplements. I guarantee it. Nothing's gonna beat that for sure. Um,
Yeah, sleep. It seems to be always the first thing that's slept on.
sure.
You know,
Yeah, you run out of time in your day, right? You're trying to get things done. Like, oh, I'll just crank this out a little bit longer. Then you want to wind down, so you watch a little TV or a little YouTube, and next thing you know, it's midnight, and you have to be up at 6:30. God, you blew another night.
yep. And also, like, once I started tracking my sleep, I was like, man, I got to be in bed a lot longer than
No, it's
eight
true.
hours specifically because it takes a
Yeah,
bit to fall asleep, and then you're up a little bit. To get 7 to 9 hours of quality sleep is like 10 to 11 hours of
yeah.
being in bed. And so
And that starts to trickle
um,
into where gadgets and things actually can make sense. Because people think, no, yeah, I go to bed at 10, I get up at 6. There's 8 hours. I did it. That's what I do. If you're actually tracking it, maybe you're restless. Maybe you're up in the night more than you think. Maybe you're only getting, you know, 30 minutes of REM sleep, and that's not a restorative thing. So I'm a fan. I wear an Oura ring to sleep. I've had one for years. And some of it's a little silly. You wake up and you feel like garbage. You know you had a bad night's sleep. But some of it can be telling too. Like you're saying, man, I was in bed for 10 hours, but I was only asleep for 6. What's going on there? I ate too big a meal last night, or, maybe I shouldn't have had those, 2 beers an hour before I went to sleep, that kind of thing. You could start to see a little bit of a pattern. Then you make some adjustments. You do a little bit of that over time. Now you're feel pretty good.
yeah, and I like data. I like tracking. I've even done a few different things. I measure my HRV most mornings,
Mm,
not most mornings, a couple times a week. But I like data. But I kind of tell people to, like, don't don't let it stress you out or dictate your day. But it does help you guide to see where you're lacking and what you can improve on. And so I like data and tech and monitoring as well. I'll try different
yeah.
things here and there, but
No, that's a that's a
um,
that's a real good point too. It's one of the things I wanted to talk about. As far as tracking, because you're right. Some people enjoy the data, and it actually relieves their stress, and they feel good. Yeah, I have a plan. I'm measuring these things. I'm just going to follow the plan and reassess the next number of months. And this is what I'm expecting to happen. If it doesn't, I'm going to make an adjustment. And they love it. It relieves the stress. They're not following the latest fad or trying to change things day to day or week to week. They're just following a plan and going for it. And other people get super stressed out about it. They're like, there's no way I'm tracking my calories. I can't do this thing. I'm not opening an app. I'm not going to have it. So you have to read the room on the recommendations for that kind of stuff and kind of meet people where they are on that. But I have people in both camps, and you can do well both ways, as long as you're not just saying completely the other way, like, hey, I'm not tracking anything and I don't care and I'm getting a poor result and I want you to fix it. Like, no, well, you had to pay attention to it in some way. Something has to happen.
yeah, that's exactly. It's like if we're trying to change some things for the better, we got to find some things to change.
Mm-hmm.
If you keep coming and everything that you do is perfect, what I've been telling you, but you're not getting the outcomes, either you're lying or we need to make some adjustments, but help me help you kind of thing.
Yeah. No, I love hearing someone say, I eat a healthy diet, and they right away move on to the next one. Like, hold on. There's about 20 minutes more of this conversation left. There's not. You can't just leave it there. And sometimes they leave after another I spare them the whole 20 minutes, and after another 10 minutes, they're surprised by what I define as a healthy diet. Like, oh man, I thought eating gluten free and I thought that was the way to go, and that was all I needed to do, or just cut my carbs. What do you mean I'm not eating healthy? So it's interesting for sure.
Yeah. What do you think, like, in terms of like longevity and resilience and stuff, like minimum effective dose of cardio resistance training? How do you incorporate that basically into your schedule for every week?
Yeah. So I think minimum effective dose. It's less than people think, and it makes it interesting. People think, I can't go to the gym 6 days a week. I'm not going to do that. So then they just do nothing. Sit on the couch. They spend 6 hours on TikTok, and meet me in the middle somewhere here. You really don't need that much, for a good return. If someone will give me even 2 hours a week to commit to exercise, and I tell people to give themselves a win. Don't commit to something you're going to fall on your face. Don't say I'm going to train for a triathlon and lift weights 6 days a week. You're not doing that. It's not happening. Let's start with two workout sessions a week. Maybe a 30 minutes each, and now you're taking some walks around the block every day. You do that for 6 months, you're gonna change yourself. You're gonna feel good.
Yep.
And you're probably gonna want to do more. That's the other part too. But if you don't, that's fine too. And even that can be enough to get people, probably about as fit and healthy as they need to be to get some good addition to their to their health span. Right? I mean, so maybe a couple hours total. You can get a lot done.
Yeah, and that's what I have them do. It's like, work with me and find something that you like, that you get a little sweaty, a little out of breath, 20 to 30 minutes most days. And then if you can get 2 days a week of resistance training, just like you said, it's going to change your life for the positive and can help carry you into those years very well.
I mean,
so
30. I was going to say, even 30 minutes twice a week. If you do kind of like supersets, some compounded exercises, big lifts that are using multiple muscle groups, you can get a whole body workout done in 30 minutes. I mean, it's going to be a hard workout. Your heart rate's going to be up a little bit. You're not going to be sitting there in between sets, texting and going on Facebook. But you can, if someone tells me they don't have time, there's your workout. You do that, you can get some good results.
Yeah, and that's what I do myself. I pretty much do full body 3 times a week, and then I run in between. I'm not really a runner, but I've kind of found I get a lot of mental health benefits from the runs, and so those are part of my routine pretty good. But that's what I do. The full body, I kind of superset everything. I knock out a lot of workouts. I lift heavy, and 40 minutes, I'm pretty much done and gassed.
Yeah.
And so that's my typical thing these days whenever I'm busy, trying to get up early, work, be present for kids, make their stuff, try and be present at the end of the day, so I'm not doing more than 45 minutes most days. So let's kind of talk about just kind of evaluation of somebody. Whenever somebody comes in, what are you looking for? What are you assessing for lab-wise or just evaluation-wise for their overall health, longevity, and what's kind of your workup for a health span?
Sure. Yeah, so it depends, and I definitely sit somewhere between being a minimalist and, let's layer some stuff in there and dig in and tinker as much as you want. And again, some of that comes back to the person too. You don't want to overwhelm someone right out of the gate with a whole bunch of stuff. Let's talk to them about the things they came in that they wanted to fix and address, and then we could explain how these other things add to that, and kind of sell them on that as we go. And now they could hit all these important health markers. So in general, and sometimes people will come to me with these labs. So they would have gotten some of these done from their primary care doctor already. So you don't have to repeat them all the time. Basic, complete blood count is a nice thing to get. We're looking at, white cells and red cells and a differential there. You get a little bit of insight there if there's maybe some sort of underlying anemia. Not always, right? So sometimes you need to dig deeper. Maybe you catch someone with an iron deficiency or a B12 deficiency or even a folate deficiency. Um, a comprehensive metabolic panel. We're looking at your, some liver enzymes, some renal markers, some electrolytes, a blood sugar that's not super helpful. I like to add on the hemoglobin A1C there, so you can see it over time. So you're not just seeing that screenshot there. Those are all some of the on the basic panel. Um, I always like to get some thyroid labs on folks. So thyroid or thyroid stimulating hormone. That's probably what a lot or some people will get done at their primary care. But at a minimum, on top of that, I'd like to get a free T3 just to get a better look and see what the thyroid is doing. For a lot of people, I get some antibodies too. Not always, right? I mean, if some of these thyroid things are out of, if someone's feeling great and their TSH and T3 looks great, I don't always get antibodies. But if something's off, I add that in there too, right? So we're not going too heavy too soon. Most of the people who are coming to me are interested in hormones too. So we're getting a total testosterone, and then a sex hormone binding globulin. That's important, so we can calculate a free testosterone, get a good accurate number there. I like to see a standard lipid panel, right? So now we could see cholesterol and triglycerides just to see what's going on there. And if someone has something out of whack or a big family history, we can dig deeper in there, get things, some more specific or more actionable things. Like if we're going to be treating someone's cholesterol, I like to see an ApoB, just a little more sensitive test, a little more. If you're looking to actually reduce risk, it's a nicer number to check. Someone else with family history or some or even some known heart disease or some concerns, I'll get a one-time LP little a. That's another another lipid marker there. But again, still this is now we're getting to kind of the second level kind of stuff there. So those are kind of the big ones there. I don't dig in a whole lot deeper than that. I don't check estrogen on people. I mean, for females, if they're premenopausal too, a lot of times, checking things like a progesterone or an estradiol, you're going to get numbers all over the place. So what are you going to do with that information? And if what you're going to do is treat their symptoms, maybe you just treat their symptoms and don't have them worry about chasing these numbers. But sometimes I'll check those too.
Yeah, we get that on women. Women, we even on our initial stuff, I'm typically throwing iron in there because we've just uncovered so much iron deficiency, especially in a cycling female.
Oh, sure. No doubt.
And
right? Yeah, I'm huge on that. You have to watch that ferritin because your H&H is going to recover, hemoglobin hematocrit bounce back, but ferritin just keeps falling down with the bleeding. Now you're tired and winded and you don't know what's going on, and no one ever checks it. It's a problem.
Yeah. Yeah, and that's what, if they're coming to us because they're run down, fatigued, it's like that's pretty high on my differential, especially if they're still cycling every month. And so I want to make sure that we're not missing that with everything else. And
a lot of men too. If I hear during the conversation that fatigue is coming up a lot, and now we're talking more, and like I get winded with exercise. Sometimes I'll even add a ferritin just off the bat, just to get a nice little screen and see what's going on. Especially if I get a guy from another clinic who's been donating blood. I get those. I see those all the time. They come in like, my hemoglobin and hematocrit are actually high, but their ferritin, great, cool. Your ferritin's 3 though. This is a problem.
Yeah, and even it's just people will still just think that they have to donate just because they're on testosterone. They need to be donating, and even some of my guys, I'm like, why is you? I was like, are you donating? They'll have indices that it like, oh, you're gonna be low iron. I'm like, how much are you donating? And they're like, oh, I've been donating every 8 weeks. I'm like, I didn't tell you to do that. And they're like, oh, but I've been on testosterone. I had a buddy.
Yeah, my friend said,
to be doing.
Like, oh man.
Yeah.
My friend said, or I heard on the internet, damn it, I told you can send me an email, you can text me, you can call me.
Yeah, it's like, I don't want to discourage blood donation from just the benefit of the community, but you're doing it too much, and now no amount of testosterone is going to fix this fatigue from iron deficiency. So let's get you on some iron and hold off on the donation for a little bit, see if we can get this stabilized a little bit. But that's something that I get from other clinics a lot, or the primary docs around here will still almost just like, hey, if you're on testosterone, you have to be donating, and just put them on that. And it's like, well, we need to monitor it a little bit closer than just knee jerk to that.
Yeah, no, it's a big thing that gets missed, and it causes people a lot of anxiety because they think, oh, how do I manage this? I need to keep donating, but my ferritin's low. I need to stop the cycle here, man.
Yeah, and it's tough. It takes so long for that ferritin, those iron stores to get back. It's hard to, it sucks when you're in that, especially if they're cruising at a 54 hematocrit or something. But at that point, I'd be like, okay, we need a sleep study as well.
Sure. Yeah, what else is going on here, right? Why is it high in the first place?
See what that cause is, and not just knee jerking to phlebotomy. Back to kind of the lipids and stuff. Are you getting coronary calcium scans or coronary angiograms for further risk stratification? If to decide if you want to start lipid meds or not, or how do you decide if you're going to bring on lipid meds?
Yeah, so at some point with any of my patients over 40, it's, again, I don't want to overwhelm people on day one, or maybe even not, the first half year, that kind of thing, if there's no immediate big risks that are coming up. But I think anyone over 40 getting a CAC or a coronary artery calcium score is a good idea. I mean, it's a low radiation CT scan of your heart. They use a special technique. They can see calcified plaque in there. Zero score doesn't give you a free pass. You're not seeing soft plaque in there. That's the argument I hear people say, oh, I don't want to do that because I don't see everything. Well, it's not I don't know if that's a great reason. It's something. It's a place you can start. So if I have someone who has, some big family risk, they already have elevated lipids, they're in the camp of statins are evil, I don't want to take any medicine for it. I said, well, let's at least get this test and take a look. If it's a 0 and you're an otherwise healthy guy and your total cholesterol is, 205 and your LDL is, 120 or 140, I'm probably not super worried, as long as you're not back to being the guy who's checking all these other boxes. But the people who seem to be the most against it are, they're trying to eat a keto diet to lose weight, and they're also diabetic and obese, and they have high blood pressure, and their lipids are high. They have a family history of I'm the oldest person in my family, or that kind of thing, and they still they can be resistant to it. So sometimes you get that result back, and they say, you have some plaque in your LAD. That's the widowmaker. That gets their attention. Right now we can kind of get them to cardiology from there. For anyone that has any plaque, I encourage them to go and see a cardiologist and kind of push for a CT angiogram. So now you get into more advanced tests where they actually put some dye in there. They give you some medication to slow down your heart and kind of dilate your vessels to get a really close look. And with that, they can do flow studies. They can see the soft plaque in there. They can get a real good idea what's actually happening. And that's actually one of the reasons it's so kind of close to me. It actually happened with me. So 3 years ago, I'm 51 years old. 3 years ago, go to my primary care doctor. We just chatted. He knows what I do for a living. I asked him about getting a CAC score, and he said, why do you want to do that? You're a healthy guy. Your lipids look pretty good. You're fine. I said, I don't know. I have some family history of high cholesterol. My grandparents died in their 60s. Let's just check it out. He said, for you, I'll do it. So it cost me $100. I went and did this thing. So again, I have all this plaque in my LAD. Right? It should have been a 0. And so now he's surprised too. He's like, how about that? So, you hear stories about, wow, that guy seemed healthy. What happened to him? That's he just died of a heart attack and no one knows why. Maybe it's because you're not looking. Right. Yeah. So
how long does it buy you? Like, say you get somebody with a score of 0, how long does it take for those plaques to be calcified to be able to pick up? So like, are you rechecking every 5 years, or what do you kind of do with it?
Yeah, that's a pretty good, right? Because some of the numbers I've seen will say you can get like 10% per year kind of thing.
Okay.
Right. So if you're rechecking it every year, you're probably really overdoing it. Probably not a great thing to do. And again, someone who's symptomatic or some other big risk factors, they're getting these other tests too, right? They're probably getting that CT angiogram and the fancier stuff sooner than later. But yeah, it's not
Yeah.
something you need to do all the time. Yes, maybe you do one. You're living life good. Maybe you recheck it again in 5 years just to kind of check and see, and you kind of go from there.
Yeah, I've been looking into even maybe getting an ultrasound just to do a quick carotid
Mm,
intima thickness.
sure.
I've seen some stuff it somewhat correlates, that way I just don't have to send them off. Maybe I'm checking that in between or something. Just the literature on it is kind of like it still says coronary CTs are more sensitive and better. It's just ultrasound, I can just throw it on there if I have it. But that was one of the things I may get just to kind of check that. I do some joint injections, and so I was halfway looking for joint
Oh,
injections
sure.
as
Yeah, it's
well.
nice
But
for that. A little guided ultrasound.
yeah, so I'm trying to justify on what
What else
things
you
to
going to
bring
use it
on that
for?
won't break the bank. Yeah, that I can use for multiple venues.
I've seen some pretty
Um,
cool, pretty cool portable ones even too. A lot of the ER seems to be the cool thing. All the ER residents want to have. They all have one in their pack. Some of them are pretty. They're
yeah,
pretty neat.
yeah. I had, in the RER we had a butterfly. It's like just hooks up to an iPad, and it was pretty cost effective, and it was pretty good. I mean, it's hard to want to use it when you have the big expensive portable one
Oh
for
yeah,
like
the
the
big
fasts and
beautiful
the
screen on there.
yeah, and I'd much rather use that for like a fast exam or something. But those are kind of nice just to play with. But that may be something I use in my clinic because it's a little bit more entry level from a cost standpoint.
Sure. Yeah, no, those are things, and
Um,
you'll see that there are some companies that even kind of sell a package of that kind of stuff too, right? They'll say, "Come in, we'll scan your carotid arteries, we'll look at we'll look at your aorta." They do a package of all this kind of stuff. I'm even seeing more and more. It seems like full body MRI pricing is coming down a little bit. I've had a
yeah, and
few people do those.
I've been kind of torn on it because just from the ER standpoint, we find so many, insulinalomas,
Oh yeah,
which
yeah,
are just for people watching it, just like we get a scan and we find a renal cyst, a cyst on your
yeah.
kidney.
No, exactly,
And
exactly.
it's like, how much workup does that need to be?
Mm,
And again, the ER mindset is always the worst. It's like, okay, so a radiologist reads it as something that needs a biopsy. So they go in and they get a biopsy and then they puncture a lung or they
sure.
cause some bleeding and now you're in the hospital for something. And again, that's just, again, worst case scenario, going to be very rare. But just from those, because I have seen that, um, that's kind of deterred me from wanting a full body MRI on myself,
Mhm.
finding little incidentalomas, and then getting four different workups to prove they're benign, and everything. What are your thoughts on them?
No, same kind of thing, right? I mean, that's the trouble with getting a test is sometimes you find stuff. Even with blood work, sometimes too, you find you're like, oh man, like this person was perfectly healthy. We found this thing that probably means nothing. Now they're anxious about it. We need to wait X amount of time to recheck it. So people who do want it, who are super interested in it, I definitely give them that warning. The chances of
Yeah,
finding nothing are pretty slim. We're probably going to find a bunch of things that don't mean anything. It could mean some scary sounding report. It could mean some sort of follow up. And if they're the type of person that can handle that kind of thing, maybe it's still not a bad idea. Cost benefit, and if you're going to see insurance paying for that anytime soon, I don't think anyone thinks that's going to happen. There would just be so many extra tests and so much extra nonsense. Probably not worth it for everyone.
kind of back to your, sometimes if you look, you find stuff. I mean, we have testosterone is, brings guys in, and a lot of guys I've chatted with, and it's like I'm the first medical provider they've seen since they're pediatrician
Sure.
and
Yeah.
they're
Yeah.
55 years old. And I found several cancers. I mean, 3 or 4 in my wellness clinic, and then I found, their hemoglobin A1C of 13 that they didn't know about. It's like, bro, you got a lot of stuff we got to talk about here, and
I found out why you're
uh,
tired and why you're peeing a lot, and you just answered a lot of
yeah,
questions.
yeah, and it's like testosterone has now gone a little bit lower on priority list. We got to get these other things dialed in, and testosterone will help later, but we got to get some other levers pulled first. Um, where do you think hormones overall fit into the health span and resilient space?
Yeah, so I think they're definitely an important part. It's not a it's not a magic bullet. It's not going to fix everything. You still have to do the do the work and do the lifestyle stuff. But things are gonna decline. Things are gonna decline, and there's nothing wrong with kind of keeping things up to normal, healthy levels as you age. I think you're going to get a better quality of life. You're going to have better recovery, better clarity of mind. You're going to be able to just come into life's things a lot stronger. So it's a part of it. It's a part of it. Not is it for everyone? I don't think it's for everyone. Is it for a lot of people who are aging? I think it is.
Yeah, and even aging, I mean, unfortunately, something it's probably a combination of a million things, but man, we're getting essentially poisoned younger and younger. It's like guys with low testosterone, women's testosterone are low as well. They're following the same trend, especially if they've been on oral birth controls for the last decade. They just haven't had a testosterone level. And man, it's unfortunate that even 20, 30-year-olds, I mean, we have on hormones almost to just get them back to functional. So it hasn't even just been the aging population, but I do think getting them on board then will prevent further decline for overall health span and everything.
Yeah, and I think
and then weight. Go ahead.
No, go ahead. What did you say about weight?
And weight, do you do any weight loss meds or discuss weight loss with the?
Yeah, I think it all comes together. So the point I was going to make there was, we're back to keeping as much lean tissue as you can have, building your lean muscle mass and keeping your body fat as low as you can reasonably get it. So I think that's where hormones come back into play again too, right? I mean, if everything's kind of falling off, your testosterone is falling, you're at a higher risk of losing muscle mass. Now you're going to be sarcopenic, right? So that's a 50-cent word for muscle loss with aging. But it's a problem. It's a problem for sure. You want to be the old frail man. You want to be the guy who's 80 years old and helping people putting their suitcase in the overhead bin on the plane, not the guy who needs the help. So it's it can help in that way. So I think you have your hormones to kind of support keeping some muscle, and then if you're trying to lose fat, it's even more important because it's very easy to go on a diet and lose muscle. Like you see someone goes on a diet. If you cut calories, you're eating less than your maintenance. You're gonna lose tissue. It's just a matter of what kind of tissue you're gonna lose. So if you're doing resistance training, it's gonna help keep your muscle. If you're eating enough protein, it's gonna help keep your muscle. As long as the diet isn't too extreme, you're gonna keep your muscle. But people who just take something like tirzepatide and sit on the couch and just eat less because they're not hungry, they're not happy with the result. The scale weight goes down, but now they look at themselves in the mirror and like, what happened here? Right? They lost a bunch of muscle. Most people aren't going for that look at the end of the day. They might say something else, but at the end of the day, people want they want more muscle and they want less fat. They just don't they don't realize that that's what they're that's the look they're going for. So I do use some weight loss meds in my clinic. Right? So tirzepatide, semaglutide.
Good. They've been great. Big game changers. I mean, I take it myself just to help keep me in control. But I'm hoping the rhetoric is changing, especially with women. I've talked several times about the strong over skinny. I want you to work on building muscle. Women just won't accidentally get bulky. I mean, I know guys that are purposely trying to get bulky, and I fail every day.
Yeah.
So
I tell people that all the time. Yeah, more so women, but even some men. I've had some guys like, I'm worried about. We're talking about weight training and testosterone. I just don't want to get too big. I promise you, if that happens, I can help you lose it. It's not that hard. It's gonna be okay. And no one wakes up no lady ever woke up as Arnold Schwarzenegger. 2 days into her training program. So it takes time. It's a long game. But it's back to this. It's what most people need. They have this stigma. They think, I'm going to get overly bulky. So now instead they're going to Pilates and yoga and some sort of pole class or some functional ball skipping weird stuff, right? All these odd court classes. At the end of the day, they're wasting all this time. Then they claim they don't have enough time to lift weights. If you just lifted the weights and did a little cardio and watched your diet, you're going to get the outcome you want. Right. So I like to
Yeah,
ask
and
people more, what's the outcome you want? Here's the best way to do it, and then, meet me halfway somewhere. So all those other things are fine and great if you enjoy them, but if you believe that those
right.
are the things that are going to get you to your goal, it might help a little bit, but it's not the biggest. It's not going to be the biggest mover.
Yeah.
It can be a hard sell.
Um, yeah, I just want to, like women specifically, I did some ortho there for a bit, and it's like, man, I just want them to avoid that fall, the hip fracture,
Yeah,
the distal radius fracture at any. If they lift a weight, it's going to help stimulate that bone to generate, stronger bones. It's going to help with balance to prevent the fall from ever happening. So we try and basically prescribe resistance training alongside the GLP-1s, along with optimal protein intake and everything as well.
yeah. Bone health is huge, and yeah, it's not all about aesthetics. Depends who you're talking to, how you want to sell it to. But it's like, you don't want to be found down. You don't want to be 75 years old and you're too weak to get yourself up off the floor. You fall and break your hip, and now you're down on the ground. And
Yeah.
not a good look.
A little change. I mean, some people are on like specific meds for longevity, metformin, rapamycin, a few NAD, a few other things for longevity and Healthspan specifically. Do you have any longevity meds that you use routinely? Are you on board with any of those?
Yeah, I mean, I love to geek out and all that stuff. I've probably listened to every podcast and show with the docs talking about these cool things. Metformin was, it's maybe not as great as people thought it was. It's still a good medication. Probably been surpassed by
Yeah.
these modern weight loss meds with everything else it can do. Rapamycin. Same kind of thing. I don't know. I don't know if it's worth it for what it actually does. But it's there. I don't have anyone that I prescribe that to. I think that's kind of next level layer things. If you're not doing all these other things right, that's a little ridiculous. It's just what are we doing? We don't need to add that.
Yep.
That's a layer. You're not there yet. If someone's truly doing all this extra stuff and they're really just knocking it out, they're getting their sleep, their hormones are dialed in, their diet is great, they're carrying a good amount of muscle, they're not overly fat, it's all happening, and they really want to try something like that for longevity, I think that's the person who could even start to think about it. But yeah, some of these other ones like NAD plus, I kind of like that because you get some more acute effect from it too, right? So you're getting a little more energy, you're getting a little better recovery. You can actually feel something day to day. Some a fan there, maybe a more of like more like a cyclical kind of nature. Maybe you're not on it, constantly year over year. Maybe you have a period of time where you use it and then come off it. Maybe cycle on to something else, kind of rotate things through. But I like those. I like those kinds of things. But I think not as the first line. It's not a shortcut and an excuse not to do these other things for sure.
Yep, that's a kind of how it's like, okay, if you are just trying to get the as longevity as, long lifespan as possible, but you're jumping over resistance training or you're still sleeping 5 hours a night, I mean, you got to get those in line before you're going to get any true longevity benefits from any of these adjuncts. Um,
Yeah, classic patient I'll see, and it's even more females than males, but definitely both. And I'm saying that mostly because females tend to gravitate more towards the like the heavy cardio training. You'll get a female who's she gets up early before work to go do some sort of cardiovascular exercise, but she's busy and has a family, so doesn't get a lot of sleep. Gets up, goes and does that exercise, not lifting weights because there's no time for that left in the day. Not eating protein because she doesn't like protein. It's not she's not used to eating it, and she's wondering why there's not getting good results. Oh, I keep gaining weight, or I don't look the way I want to look. I feel tired. But the reality is, if she slept in and then went after work and did a gym workout that was maybe half of what her cardio was and ate protein throughout the day, she'd be way better off. She'd be looking and feeling how she wanted to. So
Yeah. So as we're kind of wrapping up, what do you think, the biggest drivers in Be Hard to Kill would be?
biggest drivers. Let me think here. So I think it's you need to lift some weights. You need to not be overly fat. You need to keep an eye on your blood pressure. I think people should be checking their blood pressure at home. Keep an eye on it, right? Don't let it creep up. It's going to affect your kidneys. It's going to affect everything long term. I think you need to make sure you're getting good sleep. Aim for 7 or 8 hours per night. You're not going to get it every time, but it doesn't mean you don't try. It's good for recovery, good for everything there. You want to make sure you're doing something meaningful with your life too, right? You have some good relationships. You're doing things you enjoy doing. That's a big important part too. And if you're doing all those things, you're 90% there. You're definitely in the you're in the top percentage of people getting things done. So those are kind of my big ones.
Nice. Well, where can people find you? Like, say they are out of state listening to this and they want to follow you or reach out. How does that work for you?
Yeah, so you can find me pretty much anywhere if you Google men's Healthspan. So menshealthspan.com. I'm on Instagram, Facebook. Recently caved and went on TikTok, which is kind of interesting. I don't even know.
Yeah.
I don't even know if that's cool anymore. I'll have to ask my niece if it's cool, but I'm there too. Yeah, so menshealthspan.com, Men's Healthspan and all the socials. Email me at Mike@menshealthspan. My phone number's on there too. People can call me. I do free initial consults. So yeah, they can find me all those ways.
Well, cool. Well, thanks for coming out. Or not really coming out, but being on here.
I feel like I'm there.
Yeah, and all your insight with everything is great.
Yeah, it's great chatting with you. I'll add one more thing with the hard to kill part too, because sometimes I'll say this and people think you're talking about you becoming a ninja or something like that. There's really there's a little bit of an aspect of that kind of thing too, just staying healthy and having a good physicality about you. Because people, if you're old and frail, you can actually be you're a target for criminals. People go after that kind of stuff. They're criminals are lazy. They target those kinds of folks. So if you're someone who's 70 but you look like you're 55, they're deselecting you. They're looking like, I don't know what's up with this guy. Is he ex-military? Does he do jujitsu? Was he in prison? I don't know. Then they move on. So there's an extra part there too. It's just one other thing on the list of things. Add to your health span, keep you healthy and safe, and what are the most likely things to get you in trouble. It's there's something to it.
I guess one last question. I mean, you look the part yourself that you do really well, just in terms of muscle mass and everything. I mean, you look stacked. What is your routine with your day to day?
Thanks for the compliment, man. I wasn't fishing there, but thank you. Yeah. So, resistance training 4 times per week. And I like to do kind of hypertrophy specific training. So just geared, I'm not doing CrossFit or powerlifting or maxing out or that kind of thing, but lifting, heavy in a way that means close to failure. Probably about an hour of weight training, 4 days per week. 4 or 5 days per week, I'm doing some zone 2 cardio. And that's just kind of getting your heart rate up into the zone where it's just barely, comfortable to still talk and maybe kind of drifting past that a little bit. I'm blocking the mic here. And then I'll throw in maybe 1 or 2 sessions of some higher intensity stuff, like some interval training to kind of groove, some VO2 and get that up just a little bit. And that's kind of the gist of it. Before all of my weight training workouts, I have my my patented old man yoga routine, I call it. And it's just kind of series of warm up exercises to kind of move and get things going. And it's just some things I've collected from spinal experts and that kind of thing, just to keep things healthy. So don't just jump in there and get hurt. But it's a little way to just kind of keep limber and keep moving. That's kind of that's pretty much the base of it. And I've been doing that for 51 years old. I started lifting weights when I was about 14. I think I probably missed. I think the longest amount of time I missed was maybe a month or something like that, just for scheduling stuff. But yeah, consistency is the thing. Consistency is the thing. I just enjoy doing it too. It doesn't mean someone has to do it that much. I like doing it. So I could probably do it faster if I wanted to. But yeah.
Are you an 8 to 12 rep guy?
The older I get, the more that range extends. Right. So
Okay.
I'm no more ego lifting. Our gym is in our garage. So if anyone's out there, it's, me, maybe my wife is there, maybe the dog. They don't care. They're not impressed by how much I'm squatting or benching. So they're all
Yeah.
full range of motion, good reps. And I like to kind of cycle it through too, right? So I'll go as high as 20, 30 reps in some sets, especially lower body kind of stuff. But yeah, somewhere around there,
Yeah.
8 to 30, close to failure, seems to get the job done.
I'm trying to run at zone 2, but it's like if I brisk walk, my heart rate isn't fast enough. If I start a slow run, I jump to
Sure.
150,
Yeah, we
160.
didn't even get into all that. There's some interesting stuff there, right? Because
Yeah,
the level of fitness is going to be a big part of it too, and how habituated you are to the activity. So people see, hey, these all these ultra athletes, and zone 2 is the way to go, and that's what they do. Their zone 2 is like my sprint, right? I mean, the pace that they're going at,
yeah,
and they can't
yeah,
maintain. If they were trying to work in their zone, 3, 4, they would burn themselves out so much. So they need this kind of longer, more of this long work. But for someone who's out of shape, yeah, walk around the block, they might be a little bit winded, and now they've drifted out of that zone 2 already. So there's a fine line, especially with that running bit. It's tough. It's hard to nail that pace.
yeah. Because I purposely even try to I'll call somebody will call me, and I'll
Mm.
still just be running and be like, okay, I'm gonna run at a pace where I could
Yeah,
talk with them, but I got to think about it. And my heart rate is still 160, so that's really not a true zone 2. But I'm
yeah.
trying to be more consistent to get down to a comfortable zone 2 run one day. That's kind of a little goal, maybe, but
Yeah, no, it's a good. It's nice to have those kinds of goals, and you don't need, you don't necessarily need fancy equipment to get there, right? Because that metric that you're looking at, is it, the tuck test, pretty
yeah,
classic. I mean, you could go into a lab and get hooked up and get a VO2 max and get like a lactate threshold, and now you know exactly where that range is. Okay, my zone 2 heart rate is 130 to 145. Boom, the test proves it. I'm going to test it again in 3 months and see if it improved. Or you could do the same thing and make that same phone call to your same buddy 3 months later. But wow, this was much easier. The same output. So a couple of ways to do that for sure.
kind of with the longevity fitness stuff. VO2 max is a good indicator of longevity. Grip strength,
Mm,
those are kind of just proxies of just overall health. But do you train any of those specifically?
I don't, and yeah, that's interesting too, right? Because is it training for the grip strength that made you the healthy the healthy old man, or is it the fact that you've just been working with your hands your whole life and picking up heavy things, so you do have grip strength? I don't specifically train any of that stuff. I mean, I'll do some specific work for forearms just because I think it's cool to have muscular forearms. But
Right. Yeah.
right, and so it adds up there. I don't test my own VO2 max. I don't test my own lactate threshold. I just do kind of these the talk test kind of thing. Like I'm not afraid to answer a
Yeah.
phone call if I'm out there riding a bike. I tell people, hey, I'm okay, just so you know, nothing weird's happening here. If you hear me huffing and puffing, I
Yeah.
need to take it down a notch. But I do. I have a patient who he went to. There's a lab here locally that does it in one of the community colleges. He got his VO2 max tested. He got his lactate threshold tested, and he loves it. Totally geeking out on it. He's like, man, this is great. I know because he was giving him anxiety. He's like, where's my zone 2? Am I doing the right stuff? Am I training my in a zone where I'm going to improve my VO2 max because I know that improves longevity. So to relieve that anxiety, he goes gets these tests done. He knows exactly what that training level looks like. He's going to go back in 6 months and recheck it, see if it improved. If it did, great. If it didn't, he's going to make some tweaks, and he loves it.
Yeah. I'm a kind of data guy, so I mean, I've mentioned in the past I may incorporate VO2 max and that kind of stuff just into the clinic for offer, but like I'm just not a good runner, so I'm trying to improve that. And so I've done interval training for like, the VO2 max to Tabata in for intervals and that kind of stuff. And
Yeah, it can be brutal.
honestly, it has made my longer runs better. So I see some utility there, but they're always tough. They're not fun workouts because they're so tough.
Yeah, cardiovascular and endurance stuff is a tricky game because you can build it builds quickly, but it also falls off quickly, right? So you
It
can get
does.
really. I mean, that's why it's cycling is such a popular thing. With you look at a group of cyclists. There's a lot of 50-year-old, 60-year-old dudes in there. And they love it. It's easy for
Yeah.
them to build back up. It's kind of easier on their joints than running. And they get addicted. You get addicted to that good feeling. But yeah, you take a couple of weeks off and you come back. Those first few rides are going to be something. I had that
Yeah.
after we took a 2 week vacation. And my first ride back, I have a spin bike in the garage. Didn't take a whole lot to get the heart rate back up to 140. It's like, I guess it's going to be a
Right. Yeah.
slow ride today.
Yeah.
But it's all good stuff. It's good. It's good for you.
Well, what else? Anything else? We were kind of wrapping up earlier and then got off on another little
Yeah,
tangent.
sorry, you had it closed there, and I pulled it all back in.
No,
Uh,
I mean, it opened up all the stuff that I kind of skipped
no,
over
it's okay.
anyways. But
It's all right. No, we were kind of as it was coming up. I was jumping around through what we had for some notes here.
yeah.
I think a couple of the other things on testing and getting back into what do you test for layering things in and when do you test what. So things like, we talked about getting a metabolic panel. You get the basic comprehensive metabolic panel. Maybe you have a person who's pretty fit. They get their labs back. They see that their creatinine's elevated. They see that their AST are elevated. Now everyone's excited, right? If they saw their primary care doctor, they might think, oh, we have, what are you doing? Are you drinking? Are you doing drugs? Are you taking too much Tylenol? Is your blood pressure up, and that's why your creatinine's up? And what's wrong with your kidneys? We need to get a check your urine protein. Everyone gets excited, but those levels go up in fit people, right? Those AST and LLT are just inflammatory markers in general, and it's just tissue damage. So that heavy training guy is going to get that. So for those kinds of patients, I like to add a GGT test. It's a more specific liver enzyme that looks for actual liver damage. Yeah, I don't want to
Yep.
see those other basic enzymes 10x or something like that. That's insane. But if we're talking a little bit elevated, and someone has that normal,
Hmm.
that other normal lab value, pretty good peace of mind, right? Unless they're having some other symptoms or some other things that makes us want to dig deeper. Same thing with your creatinine. So you'll see, people who exercise, and hydration can affect that too. So there's another test called cystatin C. I don't know if you ever run that one, right? You can,
It's my favorite lab
yeah,
test.
it's a good one, right?
Like,
And
because it's like I've had them look so terrible on their GFR, and then you add that, and it's like it's perfectly normal
Mhm.
because you're on creatine supplementation. They're just heavily muscled,
Yeah.
or and so
And
it's
sometimes
always so
there's one thing from
relieving.
every column there too. They're heavily muscled. They're undertaking creatine. They had a heavy workout the day before. They were running a little bit dry when they got their labs done. And now this
Yeah,
creatinine's high. Everyone's upset. But you get a cystatin C to check that estimated flow rate, and it looks fine, and everyone's happy.
yeah,
But I've had a few patients who've had multiple tests. They were anxious about it for months because they're waiting to
yeah.
retest the thing, and no one did this other test. Or I had one guy that told his doc told him we can do it, but it's too expensive. Like, it's like $20. I think it's not that much money. What are we talking about here? I don't know,
Yeah.
but those are kind of some nice other ones to add on there.
Yeah, sometimes the docs don't know the cash pay prices of labs,
That's fair. That's fair too, right? Maybe they just don't know. They're not in that world doing it like that, so they just assume that it's. Or maybe it used to be $200 and now it's not. So they just
yeah. I
don't.
mean, like my general lab tests that I use at LabCorp, if I send it to somebody and they want to use their insurance and insurance doesn't cover it, it's like a $2,500, $3,000 worth of labs,
Mm.
whereas like they pay me $200, and
Yeah, you get a lot
that
done.
yeah, and so that's where one of the benefits of just cash pay and transparency is nice to show that.
Yeah, yeah. Even with the insurance, I have a bunch of people who like to run it through their insurance. I let them do it. I tell them, I give them a warning every time. It's like, hey, just because it was okay last time, don't hold. It might be a hard lesson.
Yeah.
And a lot of times it just comes close to the cash price anyway. Like I had a guy go through Sonora Quest and his labs came back, I think it was like $180. And if I ordered them from LabCorp, it would have been $160.
Yeah.
So they're like, that's the way this works, huh? What kind of system is this?
I know, it's crazy.
Nuts.
But
it's nuts. Yeah, I don't know what else we didn't talk about. I mean, we didn't dig into statins at all, but I don't know. That's a whole nother. There might be a whole nother.
I think we could do a whole hour-long discussion over further lipids, statins, inflammation with it. So we may just have you back.
Yeah, no, I'd love it. That would be great. That'd be great.
Yeah, discuss that.
I have some thoughts there. 'Cause I'm on Repatha myself, PSK9 inhibitor.
Yeah,
because that has there's some research that shows that actually might be able to eliminate some plaque, cause some plaque regression.
Yeah, they're going to be awesome. And I was telling just somebody the other day, I was like, they're going to be great. One, they're just not covered for primary prevention, and the studies for actual data for primary prevention, we won't get it for a decade because they're new meds, or even longer. But just from their sheer mechanism and the amount that they lower things, they can even affect LP little a, which almost nothing does. And so they're going to be awesome.
No, for sure.
If we can get them on board with more people.
Was it on your show? Or maybe I heard him on another show. Dr. Wingy was talking about how he wished he was on one, but it's too expensive. And I mean, there's a coupon for it. I know he doesn't live in the U.S., so I don't know if it applies, but I talked to my cardiologist about it. He's like, you can't get that. Insurance won't cover it. Even if they would, it would cost you $500 a month. It's probably not worth it. So I got on the internet. I found a coupon. So $5 a month later, I'm taking Repatha.
What? No way.
He didn't know about it. He's like, what? There's a coupon? It's like, there you go. Pay it forward, doc. Get someone else on this coupon. I take it back. Actually, it went up this past year. Went up to $10. So I've been on it for 2.5 years, and I think the first year and a half it was $5. Now it's $10 a month.
Man, and they've upheld the coupon the whole time?
Yeah.
That's awesome.
No, it's pretty good. It's pretty good. Yeah.
I'm gonna have to look into that because I would use that on I think about 10 different patients.
Yeah,
right now.
I think that to do it you have to have high risk. So I have this plaque, and you had to have failed high dose statin therapy.
Gotcha.
And I could not take more than pravastatin 40 milligrams. I can tolerate. Anything else, I get just the worst heartburn and reflux you can imagine. I don't get that kind of thing ever. So it's like, what the hell is this? I'm like waking up in the night from a sleep, preventing myself from regurgitating kind of reflux. It's like, well, there's no way in hell I'm staying on these meds for a long period of time.
Yeah, but you tolerate the Repatha well?
The Repatha is fine. Little, every 2 weeks, a little subcutaneous injection. Boom. Pretty good.
Yeah.
Brought my LDL down to, I think my LDL is 50.
Nice, good. That's
I'm gonna get another scan this coming year, so that'll make for a good, well, hopefully it'll be something interesting. I guess that might be interesting too to come on and go on somewhere saying it did nothing. But I'm still alive though too, so there's that.
Yeah.
So it probably did something.
But yeah, we'll have to do another one. I think we could just even dive in more on. I mean, cardiovascular is the number one killer, but it is hard to really try to convince people to start on blood pressure meds, cholesterol meds, and that's really what's going to drive it.
No, I have a lot of talks with people. They don't want to get on I don't like the idea of being on a medication. It's like, do you like the idea of being alive? Let's start there. Right. Well, I want to try diet and exercise. Like, you know what? My favorite thing is to de-prescribe a medication. If you start exercising and losing some weight and your blood pressure comes down, we can stop it. I'm not making money on this thing. I'm not trying to sell you on it. What I want to see is you be alive and happy and healthy. So, but
I've never gotten a big pharma check for prescribing a statin. Nor do I know anybody that has.
Yeah, no, I know. It's crazy. People hate the statins. I was working up a little a YouTube video on that too. So I have a bunch of notes on that. So I'm probably going to put something up on that. But yeah, we'll get together and talk about it again sometime.
Yeah, what's your YouTube handle?
Men's Healthspan.
Okay, cool.
Yeah. So far, I just have one. I have one video up there and one short, and then I have two TikTok clips that I pulled out of that same video. That's the extent of my video experience. I'll have to.
By the time we meet the next time, you'll have a lot more.
Yeah, I have to get it going. It was crazy. I put a TikTok clip up there, and on the first day, I don't know what a good amount of views is, but it had 40,000 views on.
Oh my gosh!
I don't know what the hell. I don't know what the hell. So right now it has, I think, 70,000.
Man,
I don't know.
You're killing it.
I don't know what. Someone must have liked it. That has a lot of viewers or something. Some urologist hopped on there and gave me a hard time about it. So maybe it was some of his followers. I gave it back to him a little bit too. I was like, this is pretty cool. But again, I didn't get checks from that either. Just like I'm not getting the statin checks. So I don't know.
Yeah.
No, it's fun though.
Well, cool, man. We're at over an hour, so we'll just wrap
chatting
up.
With you.
Thanks for coming on. We'll do this again in the future, and appreciate your time with everything.
Yeah, sure. It was good talking with you, man.
Thanks for tuning into the episode with Mike Belkin. He is a telemedicine provider in several states, and so you can look on his website and see if he services one of the states that you're in if you're interested. Hope you got some good insight on how to be hard to kill, overall health span, longevity. What does that mean? I do think we have several good topics that we could talk about in the future. So we'll probably have him back on board at some time. And if you have any questions or any topics you want us to talk about, feel free to reach out, leave a comment, and we'll see you in the next one.